The opioid crisis continues to affect communities across the country. Joining us now is Dr. Holly Geyer, Associate Professor of Medicine at Mayo Clinic, dual board certified in internal medicine and addiction medicine, and author of Ending the Crisis, Mayo Clinic's Guide to Opioid Addiction and Safe Opioid Use. Thanks so much for joining me. You'll be the keynote speaker at the New Jersey Summit for Healthy Aging this Friday, September 26th. Speaking about this topic, tell us, what do you see as the most pressing challenge in combating opioid addiction today?
Thanks so much for having me on, Robin. You know, as I look at the current state and landscape of the United States, we've made a lot of progress in overdose deaths within the last year. But so many people who continue to be ravaged by the problems of opioids as they relate to the consequences of addiction and dependency are fearful of coming forward. And when they don't come forward, we can't treat them. And so when patients understand that this should be a partnership with their clinician, that it's us and them versus the disease, as opposed to the doctor versus the patient, I think we'll make more progress. Let's be open about this and understand it as that disease.
Yes, we have to get rid of the stigma attached to it. It's a disease just like any other disease. How has the approach to prescribing opioids changed in recent years, and what more can be done?
We've made a lot of progress. In fact, between 2012 and 2021, US opioid prescriptions went down more than 50%. Now, to put this in context, in 2015, one out of every three US adults got their own bottle of opioid pills. That's a lot of drugs filling our streets. Now, I'd love to say it's made a lot of good impact, but the problem is overdose rates have gone up because we didn't offer alternative treatments, both for those struggling with addiction and for those who struggled with pain. We're making better progress with new and novel approaches, and I would encourage every patient who struggles with pain to make sure they're very open with their doctor about alternatives available to them.
Can you share some of those alternative methods and some practical steps families and communities can take to prevent opioid misuse?
Absolutely. The number one rule I would say is that in 2025, there is virtually no role for only using opioids for pain management. No role. They can always be paired with another treatment, and those other treatments in general should be first line. So things like scheduled Tylenol and then adding on ibuprofen, if approved by your doctor, in many studies is as efficacious as taking an opioid. Opioids should be the last resort pain medication, not the go-to drug.
And what are some alternative treatments?
We've got lots of them. So consider the categories of non-pharmacologic treatments. So these are mind-body therapies, relaxation, rest, physical and occupational therapy. Oftentimes, those are great for musculoskeletal injuries or post-surgical. And then you've got the non-opioid categories. So topical therapies, capsaicin cream, and patches sometimes work that you can buy over the counter. And then you've got the non-opioid categories, things we've just talked about, Tylenol, maybe ibuprofen, a newer drug just emerged on the market, suzetrigine. And then you've got the interventional options, and those can be great for people with very targeted pain. Why use something that affects your whole body in pill form when you can go straight after the source of injury or pain with an injection or a surgical procedure? So lots of tools in our toolboxes.
There are so many alternatives, and that is the theme of the New Jersey Summit for Healthy Aging this Friday, September 26th at the Golden Nugget, where you will be the keynote speaker, and I am honored to be the moderator. I'm looking forward to hearing your talk. Thank you so much, Dr. Holly Geyer, author of Ending the Crisis, Mayo Clinic's Guide to Opioid Addiction and Safe Opioid Use. And you are living well with Robin Stoloff.